Greetings, my name is Annah Makau, a student in St. Paul's University, Kenya. My topic is the comparison between the creation of Eve and the contemporary surgical process, which is found in Genesis chapter 2, verse 21 to 22. This article discusses the process of creation of a woman as described in the passage that I have said. Its purpose is to present an overview of the process and its significance to the contemporary medical field where surgery is involved. The article presents the scientific interpretation of Genesis chapter 2 verse 21 to 22, as well as relating the passage's contribution to the medical process where we have the surgical procedures being done. Genesis 2:21 to 22 says, "So the Lord God caused a deep sleep to fall upon the man, and he slept. Then he took one of his ribs and closed up his place with flesh. And the rib that the Lord God had taken from the man, he made it a woman and brought her to the man." In this account, we get to know that God created man from dust and later created a woman from the man. How the creation of Eve occurred. During creation, God used the same substance to create both male and female so that they may bear his image. The Hebrew word that is used to mean his ribs is solatav, and the word which is singular is sela, which means a rib, or in other translation it means one side. From the sleeping Adam, God now removes the rib. The uniqueness of the creation is reflected in the different verb used in the passage, which we get bana, which means to build. Leopold explains that building applies to the fashioning of a structure of some importance, which involves a constructive effort, which is shown in the creation of a woman. The only place where Sela might be constructed as referring to a rib is that branches off from the spinal cord. Verse 21 states that God closed the flesh after removing the rib. Ribs have been believed to have a regenerative power. This means that Adam did not lose his rib, but it was a temporal thing because it later regrew again. The surgical process that we have in our contemporary world. A surgical process is defined as the act of cutting patient's tissue for treatment or diagnosis. This can be either minimally invasive or open, involving careful preoperative planning and guidance. The decision-making before, during, and after surgical procedures highly depends on the domain, knowledge, and past experiences of surgical team. In the scientific view, the doctors uses the same method that God used during creation to make people sleep during surgery for them to be able not to be able to feel the pain. Sir James Young Simpson is the first person to discover that chloroform would put people to sleep and remove the pain sensation. The doctor had a heart for mothers and opted to apply this discovery on them to minimize their death during delivery. He had previously fought strongly for doctors to clean their hands thoroughly before helping women to prevent a deadly disease of puerperal fever that killed many women after childbirth. The Hungarian Jewish doctor Ignaz is also best known for this innovation. The comparison between the creation of Eve and the contemporary surgical process. There is absolutely no conflict between what science discovers about creation and what God has revealed to us in the Bible about creation. The purpose of creation is not to explain, the purpose of creation account is not to explain how the universe began, but to give us answers on why the universe began. Science, like cosmology, help in answering the first question, while theology helps in answering the second one. Bone from the ribcage is used by doctors to reconstruct damaged bone tissue in other parts of the body. The pioneer of anesthesia was inspired by God's creation in Genesis 2. This makes sense that God would put Adam into what we call in Hebrew tadama, that is a deep sleep. Wider Smith stated that God cloned Adam's DNA to make Eve. David Pennington, the first plastic surgeon in the world to successfully reattach a human hair, pointed out that a rib periosteum has a remarkable ability to regenerate bone, perhaps more so than any other bone. For that fact, God then performs the first recorded transplant by taking a rib from Adam to create Eve. In conclusion, the account of creation of Eve reads, "And God, the Lord God caused a deep sleep to fall upon Adam, and he slept. And he took one of his ribs and closed up the flesh instead thereof." First of all, God put Adam into a deep sleep before he operated. Then, this is sensible because this is exactly what physicians do today before operation. Adam was given, in God's own way, anesthesia, and God removed something from his side where the Hebrew word here translated to be rib, and what we call as deep sleep is called tadama. Thank you.